Atopic eczema, also known as atopic dermatitis, is a common condition affecting about 1 in 5 children in the UK. It causes the skin to become itchy, dry, red or darker and sore. The skin is like a wall made from bricks and cement. This wall acts as a barrier. It keeps water in and stops bacteria and allergens, which are things that can cause an allergic reaction, from getting into the body. Eczema means that the skin barrier does not work as well. The cement holding the bricks together is damaged and the bricks are crumblier, leading to a less effective wall, meaning it's a less effective skin barrier. Environmental factors such as allergens like pollen or dust can pass through the cracks due to the damaged barrier and irritate the skin underneath. These individual irritants and allergens play a part in switching on eczema. The damaged wall also means water can leak out. The skin becomes dry, cracked and sore, with patches of red or darker skin. On skin of colour, the redness can be difficult to see. It may appear as darker than usual, or purple patches, or ashy skin. Eczema can also appear as coin-sized patches called discoid eczema, or clusters of bumps on the skin, often on the tummy, called follicular eczema. So not everyone's eczema will look the same. Genetics is the main reason why people develop atopic eczema and related conditions like hay fever and asthma, but environmental factors can also trigger eczema to develop. This means it's not contagious and can't be passed on from skin-to-skin contact. Some children grow out of eczema, but it can often come back. What matters the most is looking after their skin every day to give it the best chance of getting better. Although there's no cure, careful treatment and management can help control eczema. Try and use the ABC rule. A is for avoiding or adapting to triggers. Triggers are irritants or allergens that can cause flare-ups. They aren't the underlying cause of eczema, they just make it worse. Irritants can include soaps, detergents, perfumes, changes in temperature, especially heat, sweat, types of clothing material, damp or mould, cigarette smoke, or messy play. Common allergens include pollen, house dust mites, animals and pet hair, and a range of foods such as dairy, eggs, or nuts. Understanding a child's triggers can help you plan how to avoid or adapt to them. For example, you can regularly clean the house to reduce dust mites. Keep the home well ventilated to stop damp and mould collecting. Avoid vacuuming around those with eczema. And keep pets out of bedrooms. B is for bland emollients. Emollients or moisturisers are the key to managing eczema. They create a barrier over the skin, which helps to trap moisture and act as a defence against irritants and allergens. Medical fragrance-free emollients should be used to moisturise the whole body. It's generally recommended to apply them several times a day, but this can vary from child to child. You should aim to use between 500 grams of emollient per week, or 250 grams for a baby. Emollients must always be used instead of soap or bubble bath when taking a bath or shower, and always when washing hands. C is for controlling inflammation. Eczema flare-ups are when the skin becomes highly irritated and inflamed. They're usually managed with topical steroids, a type of ointment or cream prescribed by a healthcare professional which is spread thinly on the eczema patches on the skin. Topical steroids should be applied once a day for short periods of time, usually 2 weeks, and always as directed by your healthcare professional. But the strength and how often they're used can vary depending on age, severity, where it is on the body, and size of affected area. As with any medicine, side effects are possible, but if used properly and according to the doctor's specific advice, the risk of side effects is small. You can speak to the doctor, pharmacist, or nurse if you have questions about using topical steroids. If there are signs of infection or the eczema doesn't respond to treatment, you should seek medical advice as soon as possible. Eczema can be uncomfortable, and being itchy all the time can easily put anyone in a bad mood. It can also affect other areas of life such as sleep, social life and being at school, and taking part in activities. A child with eczema might not understand why their skin is different to others, which might be frustrating. Explaining it to your child may make it easier to understand and make them feel more comfortable about their skin. You can normalise eczema by turning their moisturising routine into a fun game. It's also important to remember that if you're finding it difficult caring for a child with eczema, that's because it can be, and that's okay. Take time to look after yourself as well. Talking to others and letting them know what you're experiencing might help. You can contact patient support groups such as the National Eczema Society or Eczema Outreach Support for help. Take things step by step to help you and your child feel prepared and confident to manage atopic eczema together.